Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. PSA, Screening for Prostate Cancer. Introduction. Prostate cancer is a fairly common condition among aging men. The PSA blood test helps healthcare providers detect prostate cancer in its early stages. This program will explain the purpose of the PSA blood test. Anatomy. The prostate is a special gland located in the pelvis at the neck of the bladder. The prostate is important in making the components of semen. Sperm is made in the testicles. From there, the sperm travel to the prostate through two tubes called vasa deferentia. The sperm is then mixed with special secretions from the prostate and the two seminal vesicles, which are located near the outlet of the bladder. Semen, the combination of sperm from the testicles and the secretions from the prostate and seminal vesicles, is stored in the seminal vesicles. During ejaculation, the semen is forced to the outside of the body through the urethra. Before the test. Avoid heavy exercising a few hours before your PSA test. Heavy physical activity such as biking, riding horses, and swimming can elevate PSA temporarily. Avoid sex or masturbation for at least 48 hours before the PSA test, as ejaculation may elevate PSA levels. The following food and supplements can raise or lower PSA test results: pomegranate, lycopene, and saw palmetto. Tell your healthcare provider about any vitamins and supplements you take. You should also list all of your medications to your healthcare team. For instance, statins, NSAIDs, pain medications, and urinary medications can affect PSA results. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. PSA test. To detect diseases of the prostate, your healthcare provider may recommend a special blood test in addition to performing a rectal examination of the prostate. The blood test detects a chemical made mainly by the prostate. This chemical is known as the Prostate Specific Antigen, or PSA. If the level of PSA is normal, the likelihood of having a prostate problem is small. If the level is elevated, this could mean that the prostate is infected, inflamed, or enlarged. It could also indicate cancer. The normal PSA level varies with age and race. Some healthcare providers encourage yearly screening for men over age 50. Others advise men who are at a higher risk for prostate cancer to begin screening at age 40 or 45. Other healthcare providers caution against routine screening. Talk with your healthcare providers about the risks and benefits of PSA screening before being tested. After the test. If the results of the test show that your level of PSA is normal, your healthcare provider will determine a schedule for further regular examinations. If the test shows an abnormal or elevated level of PSA, your healthcare provider may recommend additional tests to check for evidence of prostate problems. You may be asked to have your urine examined. You may be given antibiotics or medications and have the PSA test repeated later. Your healthcare provider may repeat a digital rectal exam to further examine the prostate. An ultrasound of the prostate may also be done along with some prostate biopsies if needed. An MRI of the prostate can sometimes help determine how likely it is that you have cancer and where in the prostate the cancer could be. Your healthcare provider may remove tissue samples of the prostate gland with a needle. This is called a biopsy. Your healthcare provider will recommend the appropriate testing depending on your specific condition. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. To detect diseases of the prostate, your healthcare provider may recommend a special blood test in addition to performing a rectal examination of the prostate. This test detects a chemical made mainly by the prostate. This chemical is known as the Prostate Specific Antigen, or PSA. If the level of PSA is normal, the likelihood of having a prostate problem is small. On the other hand, if the level is elevated, this could mean that the prostate is infected, inflamed, or enlarged. It could also indicate cancer. If your level of PSA is normal, your healthcare provider will determine a schedule for further regular examinations. If the test shows an abnormal or elevated level of PSA, your healthcare provider may recommend additional tests to check for evidence of prostate problems. Thank you for using Explain.